Hello. I want to start off with a little experiment. Close your eyes. What if I told you the most powerful productivity tool, mood enhancer, memory booster, and immune system support is available to you right now? And it's free. It's sleep. Okay, you can open your eyes. These days, we usually think of sleep as an afterthought. We fill every waking moment with work emails, Netflix, TikTok, Instagram, friends. What's friends, right? Well, the truth is, we're living in a sleep deprived environment, and it's impacting our health, our focus, our performance, and our happiness. The great news is, if we make small changes to nightly routines, we could transform the way we sleep. Hello, everyone. My name is Pat Kolithapong, and I'm really thrilled to be speaking with colleagues, with community members, and stakeholders about one of the biggest issues that we've been sleeping on, and that's sleep. So, why sleep? It's a prescription that we all need but rarely seem to fill. The positive impacts of sleep can't be overstated, and yet we run and hide from it, like a terrible nightmare of Anki cards that we haven't finished yet. What is sleep hygiene? It's a set of practices that help a person to sleep. You could have good sleep hygiene, or you could have poor sleep hygiene, or you can rest somewhere in the middle. As a PA student, we're learning how to save others' lives, one New World question at a time. And between lectures and exams, caffeine fueled cram sessions, our group wondered how might this be affecting our own community of PA students? Through the various slides, our group is going to demonstrate the link between sleep quality and academic performance, happiness and physical health and nutrition, and how awareness and education is the first step to proper sleep. So we wanted to focus on sleep hygiene in USC PA students in their didactic year. Being in a rigorous graduate level academic program, students encounter issues that impact their quality of sleep. Research tells us that daytime drowsiness, reduced focus and efficiency, a decline in academic performance, and elevated risk for both mental and physical issues are all correlated with poor sleep hygiene. There's an illuminating research study that we explored that shows the relationship between sleep hygiene awareness, the practices, and the overall sleep quality in university students. That was published in the Journal of Behavioral Medicine. We felt compelled to explore this relationship in our community of USC PA students. That research tells us that the overall sleep quality is directly related to the knowledge of sleep hygiene. If we're able to provide a robust education, strategies to implement for these practices designed for PA students, then they might be rest assured. So, the dream. Effectively, if we are able to provide these strategies, and the implementation for USC PA students, the dream is that we'll be able to increase memory, increase emotional resilience, have a better, elevated functioning immune system, and then overall making you a kinder, a sharper, a more focused future provider.
As Pat mentioned, and as we all know intimately well, our sleep impacts our lives as students. It may seem obvious at times, but we wanted to support these feelings with data, and we found a number of articles that do just that. First, the literature highlighted that in many ways, other health issues are tied to good sleep quality. Stress, in particular, was shown to be significantly associated with poor sleep quality, something that we as students experience fairly acutely. And to further highlight that part of importance of sleep quality in students, the American Academy of Sleep Medicine writes that academic success has been correlated to proper sleep hygiene. And finally, we looked at the needs of the students that we're targeting to find out where the gaps are located And we found that the knowledge of sleep hygiene practices needed to be solidified even before changes are made to habits or lifestyles. The literature did a great job for us at highlighting the problem we assumed existed and provided also a roadmap for us for what our intervention should look like.
Before developing our intervention, a needs assessment was our first step. We interviewed Dr. Nash, who is the Assistant Dean for Student Development at Keck School of Medicine and oversees the lead unit. She regularly works closely with PA students. From our interview with her, we gained insight on the barriers, behaviors, and consequences tied to sleep deprivation. Sleep deprivation is incredibly common among first year PA students. With intense coursework, frequent exams, and overwhelming schedules, sleep often becomes an afterthought. Many students find themselves staying up late to study or struggling with anxiety the night before a big test, sometimes even missing exams due to exhaustion. But what are the barriers keeping PA students from getting good sleep? For starters, commuting in high traffic cities like LA eats into valuable time, often pushing study hours later into the night. Add in academic pressure, screen time before bed, and the temptation to study in bed, and sleep hygiene takes a serious hit. Even interactions with classmates or emotional reflections from clinical experiences can keep the mind too active to rest. And how can you tell if someone's sleep deprived? The signs are more obvious than you'd think. Students might appear disheveled, have oily skin, or seem unfocused. They may repeat questions or struggle to follow conversations. Common symptoms include headaches, jaw tension, lowered immunity, all consequences of chronic sleep. So what can help? One highly recommended resource is occupational therapy, which focuses directly on improving sleep hygiene. PA students have access to these services, though demand can create a bit of a wait. Other helpful tools include time management strategies, minimizing screen time at least 30 minutes before bed, and creating a clear boundary between study and sleep spaces. In more severe cases, a visit to a primary care provider may be advised for further support. The good news, when students seek help, improvement is possible. It may take time, but building better sleep habits can have a lasting, positive impact on academic success and overall well being. Her insight helped tailor our intervention, as we'll cover in more detail in just a moment.
Our approach to the intervention focused primarily on sleep hygiene education and less on changing habits or practices. After a number of discussions with advisors, uh, we saw great potential in this project as an agent for change going forward. Um, if we were able to harness an understanding of the needs of the first year students, where their gaps are, we could demonstrate a pattern of behavior that could potentially lead to even more successful impact. For example, asking students to evaluate their own sleep hygiene practices and make them have a change over a couple of weeks could be impactful for a couple of students who participate. However, if we're able to educate an entire class while at the same time gathering data on each individual's sleep hygiene knowledge and practice, we could potentially support students year after year with program-wide changes or changes to the school's culture around sleep. As such, we're hoping that this is the first iteration of many from this base that we're establishing here. As such, we had a pretty robust intervention and creation of materials here. We used literature review to find these resources here you see listed on the screen to assess both the knowledge, but also the practices that the students have in their sleep hygiene as it currently stands. When carrying out our intervention, we used a pre-survey first that gauged participants' level of sleep hygiene knowledge as well as their sleep hygiene practices. Then we provided the intervention. In our slide deck, we used resources we gathered from our research from the American Academy of Sleep Medicine, from the NIH, from Sleep Foundation, and we structured our presentation based on three main tenets. Primarily, it was knowledge improvement, so improving our participants' knowledge of their sleep hygiene practices. But 2 and 3 also to begin to give them the confidence and the motivation to make change as we kind of begin to highlight the gaps in their knowledge and in their practice. And at the end, after the intervention, after we were engaging in discussion with students, we provided a post-survey that gauged how they received the information and how likely they were or were not to implement the intervention that we just learned.
All right, so after designing our intervention based on how Joe described, we wanted to understand where students were starting from. So we distributed a pre survey and we got 32 responses. Again, this was built from the materials and the validated tools that Joe mentioned. The first being the Sleep Hygiene Awareness and Practice Scale from the University of Pennsylvania. This was this part of the survey evaluated patients' knowledge and students' knowledge and routines related to sleep hygiene. This was important because it provides insight into their practices that influence sleep quality and potential targets for future interventions. Um, the PSQI, or the Pittsburgh Sleep Quality Assessment, um, evaluates someone's sleep quality and disturbances over a 1 month period, and this is something that's widely validated and used in clinical research to quantify sleep efficiency and identify sleep problems. We also use the perceived stress survey to measure the perception of stress in one's life. This helps better understand PA students and the impact of stress on sleep, dietary choices, and overall well-being. As we also used the rapid eating assessment for participants, which was included in our survey. This assessed dietary intake, because this was also important to show that eating patterns can significantly affect sleep quality as well. The God and Leisure Time Exercise Survey quantifies participation in physical activity during free time, because we know that regular exercise is linked to improved sleep quality. Um, and this survey helps identify activity levels among PA students as part of their overall wellness. So these were our tools, and now we'll walk through what we found with the pre survey results. So these are some of our pre-survey results, specifically regarding sleep duration and quality, with the first graph reading during the past month, how long in minutes has it usually taken you to fall asleep? And nearly 50% of our respondents said that they reported over 30 minutes to fall asleep. With regards to sleep duration, which is the second or bottom graph, average reported sleep duration was 6.2 hours per night. And the next slide will explore some of these other key disruptive factors based off our pre-survey results as well. So here are more of our pre-survey results. So with regards towards stress and sleep, stress levels were elevated on a scale of 0 to 4, with 4 meaning very often. The average response to how often have you felt nervous and stressed was 3.3. With key disruptive behaviors that we see in these graphs. When asked to rate how certain habits affected their sleep, caffeine intake received an average rating of 5.6 out of 7, where 7 meant very disruptive. Exercising within 2 hours of bedtime scored a 5.0, which is also considered disruptive. Meanwhile, setting aside time to relax before bed was rated as beneficial, but only about a third of the students reported doing that regularly. Consistency was also another issue, with 25% of students rating their bedtime and wake patterns as very consistent, while the rest indicated variability night to night. So, despite these trends, there's good news and there's readiness for change. 97% of students indicated they were either interested or very interested in making changes to their health behaviors, including sleep, diet, and physical activity. So we can explore how we presented these strategies in our educational intervention, with Tim.
For our intervention, we met with the class of 2027 during their BMS course on April 1st, and we focus on the importance of sleep hygiene and how it relates to academic performance and overall well-being, because we wanted to have buy-in from the students. We also recommended sleep hygiene, which habits which were focused on 5 different areas, including regular sleep schedule, setting a bedtime routine, exercise, meals, and alcohol and caffeine intake. These recommendations were all evidence based, and you can see those cited at the end of our presentation. After the intervention was performed, a post survey was conducted where participants completed questions in a number of areas which focus on daytime napping, diet, smoking, and taking sleep medications, exercise habits, sleep schedule and routine, caffeine intake, and alcohol. So for the post-survey results, we had 24 responses and saw an average improvement of at least 10% across all the categories of questions. And this, which really indicates improved understanding. We also had students express increased confidence in their ability to implement these practices at home, and having both the improved understanding and confidence to implement these practices really indicate to us that there will be improved outcomes for the participants.
So in our presentation, we had a lot of considerations. So first, we used accessible language, visuals, and real-life examples to promote the comprehension of our sleep hygiene intervention. We also acknowledged that students come from many different backgrounds, cultural, religious, etc. For example, religious practices may affect sleep, maybe how they eat throughout the day or what they eat, and one can adapt our sleep hygiene tips accordingly. We also recognized that for some, disrupted sleep can be a result of past trauma or mental health conditions, and we presented our content with sensitivity and flexibility to ensure that we had trauma-informed practices in our intervention. We also made sure that all strategies were low cost, they were actually cost-free, and adaptable to all types of living situations to ensure that we incorporated equity and inclusion practices. During the presentation, we also used engaging visuals, relatable examples, and encouraged open dialogue to encourage participation among our participants. We also encouraged students to advocate for their own well-being and to share these practices with peers, family, friends, to build a healthier academic culture and just throughout their life.
So just to recap, we had 3 goals that we wanted to achieve by conducting this study, specifically on first-year PA students. So the first was that we wanted to improve the knowledge of our younger colleagues in sleep hygiene practices, and so we wanted to measure at least a 10% improvement in understanding in proper sleep hygiene practices. And we measured that by conducting a pre and post survey questionnaire directly from Sleep Hygiene Awareness and Practice Scale. The second thing was that we wanted to see a behavior change adoption. So just by discussing the topic of sleep hygiene, we were hoping that at least half of participants were able to adopt 2 or more healthy sleep hygiene behaviors, such as reducing screen time before bed, maintaining a consistent sleep-wake cycle, doing regular exercise, or any of the interventions that we discussed. We were hoping that at least half of our colleagues would adopt new healthy habits. The third was gaining confidence. We wanted our first year PA students to increase their self-reported confidence in the ability to perform these sleep hygiene techniques, and we used a 5-point scale measuring the intervention and how confident they were in able to practice and implement these techniques while they were in their first year of PA school. So by the end of the study, we concluded that we did meet all 3 goals. The post-survey demonstrated that 10% improvement was indicated in all 3 objectives that we proposed. Notably, though, it is important to note that the behavior change, adoption, and confidence building were not necessarily reflected by our data set, but more so through conversations with first-year PA students that we were able to identify just through talking to them. So that is important to note. We also were able to conclude that we did have an impact. We increased self-awareness for first-year PA students in their own sleep habits. We improved in knowledge of what sleep hygiene practices involved, and we also increased the confidence and ability to apply and maintain sleep hygiene practices. Like I mentioned before, limiting blue light exposure before bedtime, consistent sleep schedule, exercise. And then we also feel like the impact was that students might prioritize a more restful sleep than before just by participating in the study and having the conversations with us. We believe that we have impacted that they will take this subject matter more seriously in their own personal life. We did have some obstacles and barriers. One was just time. Participants were already consumed with their busy schedules. Didactic year is very demanding. There's a lot of class time followed by a lot of study time and a lot of assignments. So just getting the first year PA students to partake was a challenge, just because we understand how busy they are. The second was actually scheduling a time to conduct our intervention. We were emailing various professors, such as Dr. V, to try to find a time where our time on campus also coincided with their time on campus, so that we could actually meet. We eventually were able to find a time that worked, but that was just a little bit of back and forth. I think also that it's difficult for students to adopt and implement the ideas that we proposed for sleep hygiene because it's hard to prioritize a new habit while you're under a lot of pressure academically from school. So that could be one obstacle, is that realistically implementing a new behavior while your most important thing is passing an upcoming test is not always realistic. And then, as I mentioned earlier, some of the things that we had discussed were more verbal observations rather than something that was reflected in the data.
So, what comes next? We challenge students and faculty alike to prioritize sleep as an essential to health and not consider sleep as a luxury. So, whether it's sharing this information with a peer, starting a sleep journal, or just committing to one improved habit this week. Every step of the way matters, and we encourage everyone to take this journey on their own. We hope that everyone can normalize sleep hygiene and rest as a form of self-care and academic success, and really make it a way of life. Thank you, everyone. Thank you. We appreciate your time and attention throughout this presentation. If you have any questions, would like to discuss further comments, please don't hesitate to reach out to us. Please use our emails on this slide below to contact us.